Hello all, it's Dr. Ruth Doughton here. I'm a board-certified adult psychiatrist who focuses on implementing lifestyle and metabolic interventions to get at the root causes of mental illness. And today I'm going to be talking about who might benefit from ketogenic therapy and who I would not recommend ketogenic therapy for. Now, before I get started, I would just want to make the disclaimer that this is not medical advice and we're not entering into a doctor-patient relationship. If you're considering attempting ketogenic therapy, please discuss with your mental health provider or medical provider to see if it might be right for you. I also want to say that because this field is so new, we really don't have guidelines for the interventions yet, and different providers may have different opinions on some of these topics. So the opinions presented in this video are reflective of my own, based on my own personal and clinical experience as well as research. Okay, so that being said, let's start with talking about why I do not recommend ketogenic therapy as a first-line treatment for mental illness. Essentially, this comes down to the fact that we don't yet have the evidence base to show that it is safe and effective, as safe and effective, if not more, than traditional pharmacologic or therapy interventions. Now, this doesn't mean that it's not, but we just don't yet have the evidence base for this. And there's a lot of contributing factors to this, principally because there's not much financial incentive to study a dietary intervention as opposed to a pharmaceutical, which has the potential to generate a lot of revenue. So, and additionally, a dietary intervention is inherently much more challenging to study because there's just so many more factors to control than just whether a patient's getting a placebo or a physiologically active pharmaceutical. So we don't yet have randomized controlled trials, which is the gold standard in research, to show that ketogenic therapy for the treatment of different mental illnesses is safe and effective. But research in this area is booming right now. So there's a number of studies currently underway, including some randomized controlled trials looking at the effects of ketogenic therapy on mental health. And most of them are funded philanthropically through the Bazooki Fund, and you can learn more about them through Metabolic Mind. There are studies to show that the ketogenic diet can be helpful in the following psychiatric diagnoses: so schizophrenia, schizoaffective disorder, bipolar disorder, major depressive disorder, binge eating disorder, anorexia nervosa, obsessive compulsive disorder, major neurocognitive disorder, autism spectrum disorder, and more. So although right now I don't recommend it as a first-line treatment, this absolutely could change over the coming years as research emerges. Okay, all that being said, because of where the evidence currently stands, I would reserve ketogenic therapy for individuals who have failed traditional treatments for their bipolar, depression, schizophrenia, etc. This could mean that medications were ineffective in managing their symptoms, or that the medications were effective, but they just weren't able to tolerate them due to side effects, or maybe that the medications incompletely manage their symptoms. So there's some benefit, but they're really just not achieving their goals, they're not thriving, they're not where they want to be. So additionally, adopting a ketogenic lifestyle takes a significant amount of motivation, commitment, and organization. It must be treated as a treatment, just like taking a medication. Someone has to be committed to saying, yes, I'm going to do this every single day. The studies that we have shown that individuals who adhere more strictly to the diet, which we can measure pretty accurately with their ketone levels, they have better outcomes. So this means that an individual has to be motivated and committed to make this dietary and lifestyle choice for the intervention to be worth trying. We generally recommend giving the diet at least 12 weeks for an adequate trial, because although some individuals might respond quickly, so within the first few weeks, for many it takes longer to experience that real healing. So it can take several weeks to months. As far as the organization factor, the patient must have the executive functioning, which means the organizational planning and carry-through ability, either themselves or through support from others, in order to be able to plan and implement the diet. Now, as you can imagine, this is not always the case for individuals who have serious mental illness or cognitive issues. Another factor to consider is socioeconomic and cultural barriers. Although there are certainly ways to plan a more or less budget-friendly ketogenic diet, there are absolutely patients for whom consistent access to the whole foods required for a well-formulated ketogenic diet is just going to be a barrier. And then although of course ketogenic diet can also be catered to different cultural cuisines, but if the patient is not necessarily in charge of the food preparation in their household and their traditional cultural cuisine is high in carbohydrates, then this is going to be another significant barrier to implementing the ketogenic diet. So for these individuals, I might consider implementing extended intermittent fasting, potentially with some MCT oil supplementation, either instead of or at least as a start. And with this intervention, people can kind of get a taste of ketosis, and it's free and it's simple, so it can be a really good place to start. And we can absolutely talk about intermittent fasting more in another video. In terms of those that might benefit most from ketogenic therapy, anecdotal evidence has demonstrated that patients with serious mental illness, so schizophrenia, bipolar disorder, severe mental illness, they tend to show the most dramatic and robust responses to ketogenic therapy. And then additionally, individuals who have comorbid neurologic and neuropsychiatric conditions, so things like epilepsy, migraines, Parkinson's disease, Huntington's disease, autism spectrum disorder, attention deficit hyperactivity disorder, and dementia, they also have the potential to benefit significantly from ketogenic therapy, because not only is it going to be beneficial for their psychiatric conditions, but also for their neurologic and neuropsychiatric conditions. And we have evidence through other research to show that it's also beneficial in these conditions. And lastly, individuals who have metabolic syndrome and conditions of metabolic dysfunction in their other organ systems, so things like hypertension, obesity, insulin resistance or diabetes, dyslipidemia, cardiovascular disease, chronic kidney disease, fatty liver disease, and many others, they stand to benefit significantly from ketogenic therapy. Studies have shown that ketogenic diet improves and even in some cases reverses all of these conditions. Okay. So I know this was a lot of information, and so I'm going to stop there. I will be talking a little bit more in another video about some contraindications, some absolute and relative contraindications to the ketogenic diet. So hopefully you'll join me in that video as well. But thank you for taking the time to listen, and I hope to see you in the next one. Bye.